Hey ladies, it's been so long. I know it's been a long time since you guys heard from us. So we wanted to just get on here and say that we miss you guys. We're thinking of you. We haven't forgot about you. Of course, COVID has affected everything. It affected our family. It affected our work. It affected the women that we help. A lot of you guys have been uprooted and moved. We know that. And so what we want to do is start making YouTube videos. That way we can continue to provide you guys with health information and other important information, and also is another way for you guys to stay connected to us. And so that's what I'm going to do today. Today is going to be the first one. We're going to cover different topics from health to depression to different mental health challenges and other things that the ladies in the community
topics that I
wanted to learn about. So I hope you enjoy it. What this COVID-19 pandemic has revealed is that women of color, we are very vulnerable, right? We are very vulnerable to health issues because we already have so many health issues. Now, I'm not saying that that's the only thing that makes us vulnerable. We know that racism exists within the healthcare system. We know that we don't have great access to healthcare. We know that there is a wide range of problems. But one of the things that make us so susceptible and vulnerable to things like COVID is that we already have a lot of pre-existing conditions. And this is particularly true in Black and Hispanic women. And so I wanted to get into that to show you the health disparities in our community and to talk about some of the things that we can do about it on a systemic level to help ourselves individually and to help our communities.
Okay, ladies, let's talk about some of the health challenges for women of color. And as you can see, I'm sharing my screen with you guys. All right. So let's talk about some of the causes, right? So we know poverty and employment conditions can contribute to the health challenges. Just the fact that living in poverty might decrease our access to health insurance, and also employment conditions. If you're working in a job that doesn't provide health insurance, then of course that's going to contribute to health challenges. Also, lack of health insurance. So that's one of the things that we just mentioned, is that oftentimes in communities of color, people are working, but they're working in jobs that do not provide health insurance. So of course, if you don't have health insurance and can't keep regular doctor's appointments, that can contribute to your health challenges. You might not even know that you're sick if you can't go to the doctor. A lot of the times, even when we do have health insurance, we're not receiving great health care. It's a fact that minority communities don't receive the same type of health care as white communities. Oftentimes, Black and brown people are not taken serious when they go to the doctor, and they're just not receiving the same level of care. And so that could prevent us from going to the doctor. That's one thing. Also, we're just not being taken serious. So if we're having any type of health issue, we try to express that to a provider, a lot of times we are shown a door. And so that definitely contributes to our health condition, our poor health. Hispanics and African Americans are more likely than non-Hispanic whites to be among the working poor. I think that that's important to discuss for a minute, because a lot of times in the media or anywhere, it's a perception that Black and Hispanic people are not working people. We don't work, we're lazy, right? We don't do anything. That's not the case. We're working often in jobs that are not paying us well and who might not provide us with health insurance. So I think it's very important to discuss that point, because there is definitely a misconception that Black and Hispanic people are lazy and sit at home, and it's just not the truth. Black mothers are much more likely to die from pregnancy-related causes than are mothers of other racial ethnic groups. Wow, so I just want to stop there for a minute. So I just wanted to stop there for a minute because I think this is something that's very important to talk about, that today in 2020, Black women are still more likely to die from from pregnancy-related causes than any other racial group, and that's pretty heartbreaking, right? That's devastating to think that women of color still face these challenges in 2020, that a Black woman could go into labor and not come home. So this is something to be aware of. I want to speak to my sisters who are expecting, or my sisters who's planning to have a baby. This is something to be aware of. So please make sure that you're receiving adequate health care. Make sure that you have a good healthcare provider, good health insurance. Make sure you're receiving good prenatal care. Make sure you have a good plan for when you are ready to go in the hospital to give birth, because this is a statistic that you have to know, that a lot of us are still dying in childbirth and because of pregnancy-related causes. So just be aware of that. Let's get into life expectancy. This is important because Black people definitely have a shorter life expectancy than white people. And when it comes down to the Bronx, we have a shorter life expectancy than people that's living in Manhattan. So that's steep. And so Black people have shorter life expectancy than whites. African Americans are sicker during their lifetimes and younger when they die than whites, which I think is so sad. We have so many issues affecting our community already, and the fact that we have shorter life expectancies is just something to be aware of. We have to figure out ways to live longer, right? And I think what we're talking about today is one of those ways. If we talk about ways of improving our health and we know these statistics, then maybe we can get ahead of them. Now I wanted to let's get into mental health a little bit. Black women are less likely to seek help for mental health issues as their white counterparts. Now, this is something I can definitely relate to, and I'm sure a lot of you can. In the Black community and the communities of color, not just Black communities, women of color have this feeling that we always have to be strong. We have to suppress any of emotions that we're feeling. If we're feeling depressed, we have to suppress it, and we have to still get up, and we have to get things done, and we have to bury those emotions. And a lot of time that prevents us from seeking help for our mental health issues. And I think that's something very important that we need to talk about. We need to start normalizing the conversation of depression and mental health disorders in our community, and stop. It's not a sign of weakness if you're feeling depressed. We all feel depressed at times, especially in women. It is very common in women, and I'm gonna do a workshop on depression in women so that you guys can see how common it is. But we have to start normalizing this conversation. We have to start talking about it and seeking help when we're feeling depressed, because you should not suffer alone, ladies. Please, there's nothing wrong with feeling down. There's nothing wrong with feeling depressed, and we have to start reaching out for help when we need it.